All right, ready for a deep dive into something super important. Today, it's all about those little eyes, and you've brought us a ton of info on children's vision. Perfect timing,
Yeah.
because this stuff is crucial.
You bet. It's really interesting stuff and smart to be on top of it because good vision, well, it goes way beyond just seeing 20/20.
Right. That's what I love about these deep dives. Always something new to discover. Like, one statistic from this really caught my eye, no pun intended. About 3% of kids under 18 in the US have some kind of visual impairment.
Wow. Yeah. That really hits home, doesn't it? Just shows you how important early intervention can be. I mean, so many vision problems are totally fixable, especially when you catch them early on.
Exactly, which is where we come in, right? Today, we're giving everyone the lowdown on when those eye checkups are needed, what actually happens in those appointments, and those little signs, those red flags that parents should never ignore. For example, did you know there's actually a difference between a simple vision screening and a full-on eye exam?
Oh, yeah, absolutely. And that's a really common point of confusion for parents. It's easy to think they're the same.
Yeah, for sure.
But think of a screening. It's like that quick first check. You can pick up some of the obvious stuff, but it's not meant to be as, well, as comprehensive as an exam by, let's say, an ophthalmologist or optometrist.
Right, so it's like the first line of defense, but not the whole 9 yards.
Exactly. And you know what? The American Academy of Ophthalmology, they actually recommend starting those screenings super early, like newborn stage.
Newborn. Wow, that seems, I don't know, really young. What can they even tell at that point?
I know, right? You'd be surprised. They're not checking for like perfect vision in a newborn. It's more about those basics, like making sure the pupils are reacting to light, things like that. It's especially important for preemies or if there's a family history of eye problems.
Wow, that's amazing. Really makes you realize how important those early checks are.
So once you're past that newborn stage, what's next on the vision care timeline?
Well, the next big one is at that 6 to 12-month well-child visit. Besides the basics, they'll start looking at eye movement, making sure everything's aligned.
Okay, so those first few months are about making sure everything is developing the way it should. But here's something I found interesting in all this. It says most kids actually start out a little farsighted. Is that right? Yeah, it's true. It's actually just part of how their eyes develop. Kind of fascinating. You see, a child's eyes are still growing in those early years, and farsightedness is often, well, totally normal. It's like their eyes are still catching up to the size of their head.
Huh, wild. I had no idea. But I'm guessing if it doesn't correct itself, that's when you need to call in the specialists.
Exactly. If a child's showing signs of, say, a lazy eye, where one eye isn't tracking as well as the other, or those refractive errors aren't getting better, that's when an ophthalmologist will step in.
So between 6 and 12 months, it's more than just what they can see. It's about how their eyes are working together.
Exactly. Then, as we move into the toddler years, between 12 and 36 months, things get even more interesting.
Toddler years. I feel like that's when things get, really fun, right? I mean, they're exploring everything, touching everything. You want their vision to be ready for all that.
For sure. And this is where parents and caregivers, they can really make a difference. Because it's not always as easy as a kid saying, hey, I can't see right.
Yeah,
They might not even realize what they're seeing isn't how it's supposed to be.
totally. So what should we be watching for at this stage? Like, what are the red flags? What might tell us there's a vision problem?
Well, some are pretty obvious, right? If a kid is constantly squinting, rubbing their eyes, complaining of headaches, that's a pretty good sign.
Yeah, those are kind of the no-brainers, I guess. But what about the less obvious stuff?
Right, those are important to catch. One of the sources you shared had a great list, actually, like tilting their head to see better, closing one eye to focus, or even just constantly losing their place when they're reading.
I wouldn't have thought of those as being vision related. It's easy to miss that stuff.
It is. It's so easy to think, oh, they're just distracted or they'll grow out of it. But what if it's actually their vision, right? That's why we're talking about it.
Exactly. Knowledge is power, right?
Okay, so we've got the squinting, the head tilting. Anything else? Other red flags?
Oh, yeah. Here's one that's often missed. If they're always avoiding close-up stuff, like reading or drawing, could be a sign they're having trouble with their near vision.
So it might not be that they just don't like to read. They might actually be struggling to see the letters. Exactly. Or, on the other hand, maybe they have trouble seeing things far away. Maybe they can't follow the action during a game or see the board at school.
Wow, you don't realize how much we rely on our vision for everything. And to think, we just usually associate it with, like, reading that eye chart at the doctor's office.
Right. Which actually brings up a really interesting thing from this research, the whole concept of visual skills.
Visual skills. Okay, now I'm really curious. I have to admit, I'm not even sure what that means.
Yeah, it's something a lot of people don't know about. We tend to think of vision as like one thing. You see clearly or you don't. But there's this whole other layer of like visual skills that are crucial for, well, for learning and development and all of that.
Okay, you've got to explain this. What are visual skills and why are they important?
So the American Optometric Association, the AOA, they had this great breakdown of what they call the essential visual skills for learning. And it includes things like, let's see, eye focusing, tracking, teaming, even hand-eye coordination.
Wait, so it's more than just like being able to read the letters on the chart?
Exactly. I mean, think about reading. Your eyes, they have to work together to focus. They have to track smoothly across the page. Your brain has to take it all in.
Wow, it's like this whole complex process happening right there in our eye sockets.
That's a great way to put it.
Yeah.
And just like with, well, anything complex, if one part of that system isn't working right, the whole thing can be thrown off.
So a kid could be like acing those basic screenings, but still have some of these visual skill gaps we're talking about. That's kind of a big deal, right?
Huge.
Yeah.
It really shows you how important it is to get a real eye exam.
Mm.
I mean, the kind you get from a qualified eye doctor. They can check all those little details that a quick screening might miss.
So like you wouldn't skip taking your car in for a tune-up just because the engine light isn't on, right? You got to look a little deeper sometimes.
Absolutely. And that's a perfect segue into, well, the whole idea of being proactive. That's really the biggest takeaway here for parents and caregivers, I think. Just because a kid passes a screening doesn't mean everything's perfect, especially if you're seeing those red flags we talked about, or they're having a tough time in school. Early detection, you can't beat it.
Makes sense. Those early years are just so important for development, like building a house, right? Got to have a strong foundation. So much good stuff in this deep dive. If we had to, sum it all up, what's the one thing you want our listeners to remember?
I think it's all about, well, being informed. You've got all this great information about children's vision now. Use it. Trust your gut. If something seems off, don't be afraid to ask questions. You're advocating for those kids, right? And find those qualified professionals who can help.
So well said. It's true. Knowledge really is power, and when we're talking about something as precious as a child's vision, that power is, well, it's priceless. This has been a fantastic deep dive. We really went beyond the basics here, everything from those newborn screenings to, wow, the complexities of visual skills, lots for our listeners to think about. And on that note, I'll leave you with this. When was the last time your child had their vision checked? Don't wait, make that appointment.